So the static trial is a trial which is developed on the background of this concept that if we give continuous therapy to our patients, they are going to develop resistance. So we have patients who were treated with ibrutinib-based therapy in FLAIR study, and there are two parts of the trial. One part of the trial is looking at frontline patients coming out of FLAIR. All of these patients had 6 years of ibrutinib therapy, and most patients are in very good remission. And what we've done is that half of the patients will receive continuous ibrutinib, so no change, and the other half will stop therapy. And the patients who will stop therapy, will continuously monitor them clinically, and if there is sign of clinical relapse or their white cell count starts to go up, then they will be able to reinitiate therapy. So the primary endpoint of the study is that if they fail this approach, but essentially what we're trying to look at whether intermittent therapy is as good as continuous therapy and maybe better than continuous therapy in the long term. We also have a relapsed refractory cohort where patients who had 3 years of ibrutinib or acalabrutinib will again be randomized in a similar fashion to continuous therapy versus intermittent approach. And this trial is already recruiting in UK, and we're nearly a quarter of recruitment into this study at this moment in time.